Exercise places stress on the body. Your muscles are working harder than normal, and as a result, they require more energy. In order to create ATP, the body requires more oxygen. In order to supply the additional oxygen, the cardiorespiratory system must work harder. Let's examine all the variables introduced in Chapter 4 to understand how they change with both acute and chronic exercise. Here's a quick reminder about how the heart normally works. Now, let's talk about heart rate. How does the heart deal with the higher metabolic demand of exercise? We know that heart rate is the number of times the heart beats per minute. What would you expect to happen to heart rate with the onset of acute exercise? Exercise right now. Obviously, the heart rate is going to increase. It increases linearly all the way to the maximum heart rate during progressively intense exercise. If the exercise intensity remains constant, the heart rate will level off. This is known as steady state exercise because the increased demands can be adequately met by the cardiovascular system. Training heart rate is an effective measure of acute exercise intensity due to the fact that the linear increase in heart rate is directly correlated to the linear increase in VO2. The chronic effect of exercise training is that the resting heart rate becomes lower. Also, fit people are able to perform more work at a lower relative intensity. For example, if two people are running a mile at a 10-minute pace, the fit person will feel less intensity and have a lower relative heart rate than the unfit person. There can be no training effect on the maximum heart rate. It will actually decrease with age in both fit and unfit people. Moving on to stroke volume. You may recall that stroke volume is the amount of blood pumped with each beat. Stroke volume is related to many factors. Stroke volume increases because the left ventricle fills more completely, stretches further, and recoils elastically more forcefully to produce a greater contraction. When we start to exercise, stroke volume increases curvilinearly until the exerciser reaches about 50 or 60% of her maximum heart rate. With chronic exercise, often the resting stroke volume is increased as the resting heart rate is decreased. A fit heart works more efficiently to deliver oxygen to the tissues. It also enables trained athletes to produce larger proportional increases in cardiac output, meaning that they can perform more work. Cardiac output, you may recall, is the product of stroke volume and heart rate. Cardiac output can increase from 5 liters up to 20 or more liters per minute. What happens with acute exercise? What happens with chronic exercise? Let's take a look. When cardiac output increases with exercise, most of the change can be attributed to an increase in heart rate. Remember that stroke volume peaks at 50 to 60% of max heart rate, so its contribution after that point is minimal. Now let's talk about the physiology of the blood vessels. The total peripheral resistance in the body is the sum of all forces that oppose blood flow in systemic circulation, such as blood viscosity, how thick the blood is, vessel length, and vessel diameter. Vessel diameter is the most important. Because of their very small radii, the arterioles provide the greatest resistance to blood flow. During exercise, certain organs need more blood flow than others, as you can see in this diagram. For example, the skeletal muscles require more blood flow, where the digestive tract requires less. At the same time, as the skeletal muscle arterioles dilate, arterioles to other areas help compensate by constricting. The brain requires the same amount of energy whether at rest or exercising, although the percentage of blood flow directed to the brain changes significantly. Obviously, there are changes to the blood pressure with acute and chronic exercise. The systolic blood pressure increases linearly. You may recall that the blood pressure is the driving force that takes the blood through the circulatory system. During maximal exercise, systolic blood pressure may reach 180 to 200 millimeters of mercury. This is due to sympathetic stimulation and increased stroke volume. On the other hand, diastolic blood pressure has the lowest resistance to blood flow, and it stays the same or decreases slightly. This is really important because the ventricles need that time to fill with blood. Muscular system variables. AVO2 difference. Oxygen extraction is the difference between arterial blood leaving the heart and the mixed venous blood after it's passed through the skeletal muscles and given up some of the oxygen. Conditioning results in an increase in the AVO2 difference, indicating greater oxygen utilization by the working muscles. Exercising muscles can reduce the oxygen content of venous blood from 1/2 to 1/3 of resting levels. This indicates that your muscles are extracting a much higher proportion of the oxygen delivered to them. As much as 85% of the oxygen in arterial blood can be removed during maximal exercise in highly trained individuals. As your body adapts to chronic exercise, the capillary density is increased. Your body also produces more mitochondria. VO2 max is the ability of your body to take in, transport, and use oxygen during maximal effort. The central component of VO2 max is cardiac output. The peripheral component of VO2 max is the AVO2 difference. As you can see in this diagram, the central or the cardiovascular adaptations are the largest factor in increasing VO2 max, this nice thick arrow here. The skeletal muscle adaptations are also important, but not nearly as much as the central ones. And the pulmonary adaptations are minimal. So what happens with acute exercise? VO2 increases linearly with intensity until maximum effort is reached. With chronic training, VO2 max increases as the cardiovascular system adapts to the regular stress. We've discussed many of these adaptations, such as increased stroke volume, increased cardiac output, and increased AVO2 difference. These add together to allow VO2 max to increase significantly. Some people are able to improve their VO2 max by 50%, although the average is closer to 20%. There are some genetic limitations to any type of training improvement. The highest VO2 max readings are in the high 90s, and they belong to cross-country skiers and cyclists. The highest VO2 max readings that are recorded for women athletes are in the high 70s. Let's take a look at a summary chart of what we've covered so far. It's helpful to review and check for understanding. When exercise commences, heart rate, stroke volume, and cardiac output all increase due to sympathetic stimulation and increased venous return. Systolic blood pressure increases to deliver more oxygen to the body, whereas diastolic blood pressure remains constant in order to allow adequate rest and filling time. Total peripheral resistance decreases due to the vasodilation in working muscles. Oxygen extraction increases in the muscles so that ATP can be produced. Because both cardiac output and oxygen extraction differences increase, VO2 increases to meet additional metabolic demands of the body. The respiratory system is overbuilt for the purposes of providing gas exchange during exercise. We never reach maximum capacity for ventilation. Lung volumes are largely a function of age, height, and sex as opposed to fitness level. The lungs are not a muscle that can be strengthened by training, and it's unlikely that pulmonary function limits ability to exercise, unless there's a disease state such as asthma. We're going to skip the video for now. The acute changes that occur are the respiration rate increases, you breathe faster, tidal volume increases, and minute ventilation increases. So the amount of air that passes through your system every minute increases with exercise. A ventilatory threshold is the point during incremental exercise at which ventilation increases out of proportion to the increase in oxygen uptake. In this chapter, we've discussed changes in the physiology of the body related to exercise. A future fitness and health professional should understand the